Today I'm making a video about a very common and asked question about jobs after AMC 1. How much does it take to get a job after passing AMC 1? And what are the chances to get a job after AMC 1? I will be very honest in this video. I will share my experience, which is the same experience as other IMGs as well. So I have done my AMC 1, I've done my AMC 2. I had to find a job, as you know, and as I said previously in other videos, I got my job only with AMC 1. And I think the most difficult part in the whole process was not the exams. I know AMC 1 and AMC 2 are already difficult exam, but it's not as difficult as getting a job. So definitely getting a job is the most difficult part in the process. It's the most frustrating part in the process. There is a lot of rejections. But the good news is that it's not impossible. So it's doable, okay? It's just hard, difficult, and needs a lot of commitment, but it's doable. So let's break a little bit more about this. So there are some statistics from the AMC Council, which are great, that says that people in the standard pathway, 77% of them took them more than 1 year to complete the pathway. And the main thing were delays in passing the AMC clinical and in getting the job. So the majority, almost 80%, will have issues in passing the AMC clinical and in getting the first job. And this is a fact, and that's okay. So getting a job would take you up to 1 year sometimes. Some people even more, and some people less. Some people take them 3 to 4 months, some people take them 2 to 3 years. It depends. In my observation, if you have a good CV, a good cover letter, and you keep upgrading your cover letter and your CVs, and you keep adjusting your information, and you are very proactive and you are constantly applying, you would get a job. However, if you are applying for 5, 6 months, you're just getting rejections. It's very normal. It's a human nature to feel frustrated, demotivated, give up, and stop applying, which a lot of IMGs do, which is a big mistake. You have to come with the right mindset. You have to come with a mindset that it's hard. You are competing with thousands of other doctors who also have AMC 1. So having AMC 1 is not a big achievement anymore when it comes to applying for jobs, because everyone has AMC 1 to apply for jobs. So you have to come with a mindset that you are competing with thousands of people who are for, 3, 4 vacancies that the hospital may have. So it's very normal to get rejections, but we should not give up. There is always a chance to get into the system. And that's why there are so many IMGs working in the system, because they were continuously applying and continuously consistent with the, with the progress. So what I want you to do is after AMC 1, you have to apply for jobs continuously. It takes an average of 100 to 150 applications to secure one single interview. And once you secure that one single interview, you have to do your 200%, your 300% to get through that interview. It's a shame to spend a lot of time applying, getting an interview, and not passing the interview because of lack of preparation. Okay, so interviews have to be prepared very well. When I prepared for my interview, it took me 2 weeks to prepare for my interview. I was preparing constantly, making sure I'm ready to any type of question. So, and it takes 100 to 150 applications. I have read comments where people took them 500 applications. And I really salute these people who applied for 500 jobs, got 499 rejections and 1 job application and 1 job interview, and they passed the interview. That's real commitment. It took them 1 year and a half. They applied for 500 position and they got it. So the goal is to get it right. So no matter how many applications you have to apply, you have to keep applying until you get it. And this is again the same thing, that 77% of people in the standard path will take them 1 year. So you have to start with that mindset. But 1 year not of relaxing, 1 year of active finding job, active application, active emails. You can also email hospitals. And as I said before, once you apply to a job, email the hospital, let them know that you have applied, let them know you are interested. If you get rejected, it's completely fine. So as I said, from this 100 to 150, 99% will be rejections and 1 will be an interview, hopefully. And then factors causing delay in the standard pathway, secure employment. So 60% delayed in this process because not able to secure an employment. And that's what's expected, and that's what I'm saying. So you're not the only one struggling to find a job. Everyone is struggling to find a job. 60% have delay in finding a job. The only difference is that those who remain committed, those who apply for jobs constantly, will end up getting a job. And what do you do in 1 year? I don't want people who just stay 1 year just applying and not progressing in anything else. That's not the way. You have a whole year or a whole 2 years that it will take you to find a job. So don't waste 1 year or 2 years in nothing. What I want you to do is prepare for AMC2. Preparing for AMC2 is not only for passing the exam. I know the passing rate is 35%, but it's not only about passing the exam. Preparing for AMC2 will make you understand better the Australian healthcare system, how to take history, how to do a physical examination, what they are looking at you for an intern level position. It will make it easier for you to get general registration. It will make it even easier for you to find a job if you are not able to find it with AMC1. So that's the thing. So imagine we have two candidates. Both of them have AMC1. One is only applying for jobs and applying for 1 year and still no job. One is also applying for job, applied for 1 year, but at the same time, this other candidate was preparing for AMC2. Still no job for both of them. This other candidate passed his AMC2, and now he has a very big golden ticket to find a job. So, and this person has not prepared for AMC2, has not done anything in that year, continue applying, and may or may not get a job. And then even if this first candidate gets a job, if he doesn't have AMC2, it takes long way to get your general registration, because then you either have to pass AMC2, so he will end up having to pass AMC2 anyway, or you either get into a WBA program, which is really hard to get. I know a WBA is a 99% passing rate, but in my current hospital, the waiting, so to get into a WBA, first you need a job. So this person needs first a job, minimally has to work 3 to 6 months in the hospital. So once they work, they have to apply to the WBA once they are working in the hospital. And then they have to wait another year to start a WBA. So the waiting list is 1 year. And once you start the WBA, you need another year to complete the WBA. And then you get general registration. And as you know, you cannot do any training without general registration. So everyone needs general registration to get into training. So the quickest way to get your general registration is by passing AMC2. And then also preparing AMC2 makes you more confident in your approach. So I would really recommend it. You have 1 year of applications. Use that time, start preparing for your exams as well. And then keep progressing as a doctor. Don't get obsessed with getting a job as soon as possible, because it's not the reality, it's not a fact, and it's not practical. Of course, you have to try your best, but in the meantime, join courses, start your training in your home country. It doesn't matter, even if you will have to leave it at some point, at least you are in a training program, you're learning, you're becoming a better doctor. Learn new skills. If you don't do cannulations, in Australia, we do cannulations, learn ultrasound cannulation, normal cannulation. Learn any new skills that you could learn. And I think personally, the most important thing you can do is practice your English communication skills. If you see here, the most important qualities that help doctors in practicing medicine. So we have adaptability, but we have English fluency, which is the second ranked one. And I think it makes a big, big difference. I think I've been able to progress very well in my work because of my English. I can see IMGs who don't have strong English communication skills to really struggle a lot. So just simple exercise of you go to the hospital, you're working, you're a doctor, you have a patient. So come home and practice that patient or present that patient to yourself in English and record yourself and then see how you have you done. And AMC2 will also help you in this, because AMC2 is about role playing, about speaking, about taking history. So start preparing to be a doctor in Australia. It's not about only getting a job. There are people who have got a job in Australia and then they were not able to progress with the registration because the hospital thought they are not capable or not competent as doctors. And then their career in Australia finishes. And that happened. So once you start working in Australia, the first year is always supervised practice. You get assessments every 3 months. You get, people are watching you. People are seeing how do you manage patients. And there are instances that the hospital has not been happy with the candidate, with the doctor, and they report to APRA that this doctor is not safe to practice. And mainly not because of not knowing medicine, mainly because they don't know communication skills, they don't know how Australia health system works, they are not proactive in learning. So I don't want you to fall on that. I want you to come well prepared, confident, good English skills, and at the same time, while doing all this, you have to keep applying. It's an exhausting process, I agree. I spent my 2024 just with books, computers, interviews, preparation, cover letters, CVs. It was horrible, horrible, but it was worth it, okay? It's not easy for anyone. People who IMGs who are working in Australia, they all struggled. They all went through a lot and they all been very consistent. And all the IMGs I know in my hospital, I had to apply to 100 applications to get a job in the hospital. So hopefully that was an insightful video about how things are after AMC1. It's not like Australia it's just waiting for you to pass AMC1. That's not the reality. There are thousands of other doctors who want to come to Australia. And the reality is Australia does not have position for everyone who just passed AMC1. You have to be beyond that. You have to be great in your English. You have to be maybe have AMC2 as well. You have to be great in your clinical experience. You have to have something different and something that outstands. So that's the reality. I'm being very honest. I'm not saying it's impossible. It is doable. It is possible. That's why we have IMGs working in Australia. But I'm not saying it's an easy thing. It needs a lot of work and a lot of commitment. So hopefully that was helpful. And thank you again for watching my video. You can always subscribe for videos more so I can keep making videos like this. And see you soon in the next video. Thank you.